So a stress EKG is a diagnostic test used to assess your heart. Now what an EKG does is there are 12 leads placed on your body, one on each limb and a couple on your torso and abdomen. What the EKG does is it detects the electrical conduction system of your heart to make sure that it's firing from your SA node all the way down through your ventricles to make sure that your heart's pumping properly. What the EKG will then do will come up with a graphical assessment of your heart rhythm, making sure that ventricular depolarization is happening properly and all that good stuff. Basically, how the test works is the leads are placed on the limbs and the abdomen, as I said, and then the examiner will then determine an appropriate exercise target heart rate for the patient. Then what will happen, the patient will begin exercising either on a treadmill or a stationary bike. The patient will be monitored during this entire procedure, making sure that they aren't having any symptoms of angina, shortness of breath, nausea, dizziness, or the examiner will be monitoring their data, making sure that their EKG or blood pressure isn't reacting abnormally. Physicians will order stress EKGs if they suspect the patient has coronary artery disease. They will also order them if patients are entering cardiac rehab after a cardiac event. Or they will simply want to assess how a patient's heart reacts to stress or exercise. Some contraindications for a stress EKG include a recent myocardial infarction, uncontrolled symptomatic heart failure, unstable angina, pericarditis, and other serious heart conditions. Your physician will not order a stress EKG in these conditions.